Hello. On June 5th, 1981, in the CDC's Morbidity and Mortality Weekly Report, or MMWR, disease outbreak investigators reported 5 immunocompromised men with pneumocystis pneumonia, or PCP, who also had a history of sexual contact with other men. An intense investigation was initiated, and within 18 months, epidemiologists were able to identify the significant risk factors for the syndrome of diseases that later became known as AIDS. The NIH and the Office of AIDS Research sanguinely mark the 40th anniversary of this milestone investigation that ignited the robust response to AIDS and discovery of the causative virus we know as HIV. My name is Dr. Timothy Holtz, and I serve as the Deputy Director of the Office of AIDS Research at the National Institutes of Health. Our office sets HIV research priorities, creates policy, and determines HIV research budget allocation across the agency. I am also a Rear Admiral in the U.S. Public Health Service, committed to serve and improve the nation's public health. I have spent my career working in both domestic and global HIV and tuberculosis treatment, prevention, and control programs, from small community health centers through the Indian Health Service and at the CDC and now at NIH. I am continually inspired by the resilience built through the 4-decade journey in HIV prevention, care, and treatment discoveries and implementation. Much of the progress over these last 40 years has emerged from research funded by the NIH and thus from the American taxpayer. The NIH HIV research priority agenda has evolved since the 1980s, but continues to be strategic, nimble, and balanced in its approach. The NIH HIV research investment has led to groundbreaking discoveries and innovations, prevent new HIV infections, and improve the health of all people with HIV. These advancements would not be possible without the volunteers who have participated in NIH-sponsored clinical trials through the AIDS Clinical Trials Group, the HIV Prevention and Vaccine Trials Networks, the International Maternal, Pediatric, and Adolescent AIDS Clinical Trials Network, and the Microbicide Trials Network. Through multifaceted collaborations, the U.S. government continues to work to ensure equitable access to quality services for the approximate 1.2 million Americans carrying this virus, as well as the 38 million people with HIV worldwide, particularly those populations that are disproportionately affected, while continually remembering the more than 32 million people who have died from HIV-related illnesses globally since the start of the epidemic, including 700,000 Americans. I am honored to be celebrating American leadership, unity, and compassion in the HIV response, and supporting the goal of ending the epidemic in the US and worldwide. Thank you.